Good morning all, and thank you very much for joining us. My name's Will Alstein, I'm a Commercial Director at YouGov, and this is the latest in our COVID-19 webinar series. What I'm delighted to bring you today is a behind-the-scenes look at the data and a glimpse into the thinking that the scientists have and are using to fight the pandemic. I'm joined today by Gavin Ellison, YouGov's Director of Public Services and Not-for-Profit, and also by Sarah P. Jones from Imperial College, London. What you're going to hear from us today is I'm going to talk very briefly about YouGov's 3 offers that we have in relation to COVID-19. I'm then going to pass over to Gavin, who's going to walk you through the behavioural data. I'll explain what that behavioural data is in a minute. And then I'm going to pass you, Gavin will then pass over to Sarah P. Jones from Imperial College, London, who will give you a glimpse into the science, how scientists are using our data, explanations of what R is, and look at some of the models that are in play to ethically nudge behaviour. But let's just be clear about what we're talking about today. And I'll talk you through the types of data that we have on offer. But first of all, from the very outset, when COVID-19 was becoming a global issue and was turning into a pandemic, the YouGov CEO made it very clear what YouGov's mission was. And that is to serve the public good. And by that, what we mean is giving everybody who would like it the opportunity to contribute to the discussion and have their voices heard by taking part in one of our surveys, in one of our chats, leaving comments on our website, and giving that aggregated data to organizations that can make a meaningful difference in the fight against the pandemic. And to that extent, we've been working with a number of public health organizations through our partnership with Imperial College London, including the WHO. But let's be clear about what data we're going to hear about today, because this is a departure from our usual webinar series, where we often talk about the consumer monitor. The consumer monitor is our subscription offer that is available to clients. It covers levels of concern and trust, changes in spend and media consumption, economic confidence, employment, and future consumer habits. If you are interested in that, then please do email us at info@yougov.com. Elements of that consumer data we put into the public domain, and they are some top-line figures that everybody who's got an internet connection can enjoy. That data is available on our website in the form of interactive charts, and you can also download the data. But what we're here to talk about today is the data that YouGov is creating and designed for public health organizations and policymakers. Gavin will go on to talk about exactly what the survey covers, but it is related to health behavior and the willingness of the population to do as instructed or as advised by policymakers, so that they can better understand the way that the population is behaving and the way it is likely to behave when it comes to this pandemic. So that behavioral data is available for public health organizations. We've, for the first time, made it open source on YouGov, so that you can actually download the row-level data that we're going to talk about today. That is available at GitHub, and through our academic partnership with Imperial College London, we've also created the COVID Data Hub which is a Tableau service. The links to all this are in this slide deck. I will put them up at the end of this session as well. And you will receive a copy of these slides. So please don't feel as though you have to rush to ask for those links. While we're talking about asking for things, and we've timed this so that there will be time for questions at the end. If you are keen to ask a question, we've opened the chat function now. Please do write your questions in that chat function, and we'll get round as many of them as we possibly can at the end. I've mentioned Imperial College London a number of times already. Let me be very clear about the relationship that we have with them. So Sarah, who is on this call, our CEO, put a call into, I'm thinking of probably about 3 months ago now, Sarah, where Stefan asked, what can we do? What can we do to help? And it was through that phone call that we established our academic partnership, supplying data through Imperial College to public health organizations. And through that, we're also delivering data to the World Health Organization. But that's more than enough of me. What I'm going to do is pass over to Gavin, YouGov's Director of Public Services and Not-for-Profit, to take you through a little bit more about that behavioural data survey and some highlights from it from the European market. Gavin.
Thank you, Will. Morning, everyone. So yes, as Will says, I'm going to explain specifically about the global COVID-19 tracking study, which was formed in partnership with Imperial College London. So the study, as it was created, has covers a wide range of subjects, and those subjects are listed on this slide. We include questions about experience of symptoms, about response to symptoms in terms of isolating, self-isolating, but also people's projected future ability and willingness to self-isolate if they develop symptoms in the future. We asked them some interesting numerical-based questions, which is particularly important for modelling public behaviour. So those numeric questions include things like the number of times that they left the home on the previous day before taking the survey, the number of people that they came into contact inside the home and outside the home, number of times they've been washing hands, for example, on the previous day. And collecting data in this numeric form is really important for analysing behaviour and behaviour monitoring. We're also interested in people going outside the home to work, and to see which sectors they're working in, and how those who are going outside to work differ from those who are staying at home to work at the moment. There's a list of 20 common preventative measures, things like avoiding small social gatherings, wearing a face mask, all those kind of list of behaviours which would help prevent the spread of the virus. And we ask about how they're doing that, how often they're doing that. We have a section which is relatively new in the survey, which covers mental health, using the very commonly applied PHQ-4 scoring system, which is a set of 4 questions with appropriate scores derived from the way that people answer those questions. And we're also using the Cantrell Life Satisfaction Ladder, which is one single question that is connected to life satisfaction. We're fortunate in the way that we set up the study that we have offered the opportunity for local in-country academics and public health organisations and governments, including WHO in-country teams, to add additional questions to the survey every time it runs. So that's a resource that has been used in many of the countries that we've been covering. And coming soon in the next couple of weeks, we have a very comprehensive section in the survey about masks and face coverings, including everything you could ever want to know about those subjects. And a small section on vaccinations as well, which is an area of key interest for policymakers, both in terms of a possible future COVID vaccine, but also in terms of people perhaps not getting normal vaccinations, which they should have been done as business as usual. The survey has coverage across 29 countries globally, indicated on this map. And the key facts and figures about the study: we began around the end of March. It's been running weekly in 10 countries and every 2 weeks in 19 further countries. So far we have around about 100,000 individual responses in the data set. Each response we have back is importantly date stamped, so we know exactly what day the person completed the survey, which is really vital for the use of this data by academics and public health organisations. And we have a series of contextual information about the people who are completing the survey. Some of the basic demographic details. The presence of children in the household is an important one. The number of people living in the household also is particularly important in this study. And of special interest as well is whether they have pre-existing health conditions. We have a list of those, of around sort of 10 to 12 health conditions, which enables the data to be analysed in that way. The focus for this webinar is the mainland Europe part of the study. So we have 6 waves of 1,000 responses in Italy, France, Germany and Spain, and we have 2 waves of 1,000 in the other countries covered by the focus of this webinar. And so into some of the questions. So this is a question about would you choose to self-isolate if you started to develop the symptoms of coronavirus? And this, as you can see, varies from a high in Sweden and Spain, around 86, 85%, down to a lower figure in Germany of 67%. Looking at some of the details of that data, German men say that they're less likely to go and self-isolate than women would do, and it's lower among the lower age groups, and it's higher in the over 70s. So 76% of those aged over 70 would go and self-isolate if they started to develop those symptoms. I mentioned that we're interested in people working outside the home and how that affects people's behaviour. So you can note in the case of Germany there, so just 54% of those who are leaving the home to go and work in manufacturing would self-isolate if they started to develop symptoms. And you can see how that would be interesting for policymakers to look at the varying attitudes across the industry sectors. So it's the same question, but we of course have the ability to track that over time with a weekly surveying in France, Germany, Italy and Spain, and that's what this chart shows here. There is a general downward trend in whether people believe they would go and self-isolate with symptoms. The reasons behind this, I mean, we can speculate about. It could reflect the easing of lockdown measures more recently, where people feel that they would actually still, go out. It could also reflect, increased confidence in other preventative measures that they could take when they leave the home, such as wearing a mask, or it may just reflect general sort of confidence in the levels of testing and tracing that have now been established in many of the countries that we're surveying. But you can see there is that clear downward trend. Particularly, policymakers are very interested in people's ability to actually self-isolate if they're advised to. So this is in reflection to perhaps some of those who might struggle for reasons of age or socioeconomic background have the ability or the support structure in place to actually do it if they needed to. So there's a question which explores that in terms of how easy or difficult they think they would find it to self-isolate. And of course that could be also connected to their working status and the fact that they still feel as if they need to leave the house. They would find it difficult to self-isolate if they were advised to, because they need to leave in order to work. So this has quite a variation by country as well. And there's some information on differences there. So for example, in Spain, 71% of those who are not working outside the home, so sort of home workers, would find it easy to self-isolate. But you can see how very different that is to those who are those who have to leave the home in order to work. So you can see the difference there with those who are working in food retail. There's a question about self-isolating if being specifically asked to by health professionals or health agencies, in which case, you know, with that specific ask from those organisations or professionals, the vast majority of people would therefore take the measure of self-isolating. And you can see that it varies from a high in Italy and Spain, down to lower figures in Finland and in Germany. And again, it's women rather than men who are the most likely to respond to that being specifically asked. And again, there is quite a significant variation by age. So those in the youngest age group are the most, perhaps the least willing to do that if requested to do so. Whereas those in there who are older and perhaps have some of those pre-existing health conditions are more likely to respond to that specific request if it was made. And again, those who are looking at that particular question over the course of the weeks, we can see this chart is just for Germany, so we can see that those figures are gradually declining in Germany. So that willingness is declining. As I say, this could well be related to the path of lockdown. It could be related to increased confidence in the measures that are being set up to handle people who have developed symptoms. But again, you can see there's an interesting element when you look at the data by the health conditions that people might have. So, those who have high blood pressure, those with mental health conditions such as anxiety or depression, those with heart disease as well, they are more likely to respond to that request to self-isolate if it became necessary. And that's what you'd like to see. That those who with the greatest sort of vulnerabilities are following that advice. This is a very interesting and very pertinent question at the current time as the lockdown restrictions ease. The rate of wearing a mask, or frequency of wearing a mask or a face covering, it varies, as you can see, dramatically between countries, and a very, very high figure of 91% frequently or always in Italy, people wearing a mask when they go outside the home. Also pretty high in Spain, but it starts declining. France and Germany, very, very similar. And then many of the other countries that we've been including, the rates are pretty low around face mask wearing. And this is something with huge differences between different countries in Europe. And looking to see, who is it that is taking that particular preventative step. It is vastly different on the basis of age. So this is the example of just France now. So mask wearing among the youngest age group surveyed, the 16 to 29-year-olds, is around 39% who are doing so frequently or always, and that compares to a high of 55% among the over 70s when they leave the home would be wearing a face mask. And because this issue is changing dramatically over time, it's interesting to see it in this format here. So since we started the survey in very late March, there's been a significant increase in Italy, which is the highest line there, but it was starting from a relatively high base of 83%. The biggest increase, as you can see, is in Germany. So back then, at the end of March, we plotted that it was around 19% of people who were doing that when they left the home, and it's now up to 80%. So a really, really sharp increase. But when if you have the time to go into the data, you can obviously compare questions like this to those who are in the Asia Pacific region and the countries there where mask wearing figures are extremely high, much higher than they are in Europe. We're interested in the number of times that people are washing their hands. There's another, this is an example now of one of those numeric questions that I asked. So asking to estimate the number of times they've washed their hands in the previous day. And hand washing frequency is highest in Denmark. Denmark is leading the way with that, closely followed by Italy. And it's the Netherlands that has the lower levels of hand washing frequency. And displayed in the form of a map, the average numbers. So the average, as we make it, was Denmark with 18 times in the previous day before taking the survey, and down to a low figure for 10 in the Netherlands and 10 in Spain as well. I'm afraid to say for us men that the average number is 11 compared to 13 for women. And there is interesting differences between those with children in the household who are more likely to be washing their hands, which might be due to some of the things they're having to do with their children, of course. But there are also some key differences, as you can see, in terms of the professional industry groups, those who are leaving the household, with healthcare workers, as you'd expect, and social care workers washing their hands more frequently than people who are working in other sectors. And now I'm going to hand over to Sarah to carry on the story from the scientific side.
Fantastic. Thank you very much, Gavin. Really, really interesting data across Europe there. I think it's some of the stark differences between markets is really, really interesting there. Right, moving on to the science. So we are incredibly lucky to have with us Dr. Sarah P. Jones from Imperial College London. Sarah is a doctoral researcher in health behaviour at the Institute of Global Health Innovation under David Navarro, one of 6 COVID-19 special envoys to the World Health Organization. But she's not just a scientist. She has also held previous commercial roles. Most notably was the global marketing director for De Beers, the LVMH brand. So she knows and has been sitting in many of the seats that our audience today has been sitting in, looking at this from a consumer angle and thinking about what the implications are. So without further ado, let me hand over to Sarah, who's going to walk us through some of the science. Sarah.
Thank you so much. Imperial College London has been working closely with YouGov offices in 29 countries since March to get data and insights into the hands of researchers around the world who are urgently in need of real-time data. It would be difficult to imagine a more pressing time for data companies to offer data for the public good, and I know that I can speak for all the scientists and researchers involved in our Imperial College London YouGov collaboration who have benefited from YouGov being so generous with the data when I say thank you. On the screen, you can see where the data researchers are using is available for all of the public, and it's available to all of you on this call. If YouGov clients have questions about how to use this data being provided by YouGov to Imperial College London, or if you have questions about the models behind what we will talk about today, please don't hesitate to contact info@yougov.com, and they have kindly offered to put you in touch with me personally. There are 4 main activities that we are working on together to support the research community. And we are providing policy and guidance to countries around the world. The first is coviddatahub.com. That is the Imperial publicly available dashboard. That's created by our collaboration with YouGov. It's updated daily with new data, including the Johns Hopkins case and death data. We are tracking consumer health behavior related to COVID with the aim of developing timely insight bulletins, which we then share with our research network. This data is available on YouGov's GitHub page. We are collaborating with and informing other researchers. I'm contacted every week by other researchers who are using the data for various scientific projects around the world. Our close collaboration of networks, our close collaboration of researchers includes epidemiologists, public health experts here at Imperial, behavioral scientists and practitioners such as the behavioral risk team at the WHO, economics collaborators such as Jeff Sachs and well-being expert John Hallowell, and the entire World Happiness Report team. One of the most important factors to consider when looking at behavioral data is the policy context in which consumers are operating at the moment. Researchers such as ourselves are gathering policy data about how stringent restrictions are at the moment. This is from a source provided by Oxford University as a free service to the public. And you can see here a visualization over time about restrictions on public gatherings, which have taken over the world very quickly. This type of data is available in numeric format from Oxford University and is also resident on the Imperial College London YouGov dashboard, coviddatahub.com. Now, why is this context so important for researchers, and why do you also need to track this data? Well, in order to control unchecked virus transmission and virus reproduction rate, it is essential that the public performs the kinds of public policy measures, such as those recommended by the WHO, at the right time. When researching why and how health behaviors are occurring, it is important to consider the context in which they are happening. This helps researchers to unpack the differences in behavior and attitudes. One useful way of doing this is by comparing differences in behavior between countries operating under higher stringency policies at the moment and those with lower stringency policies. For example, among the higher stringency countries, 69% of people reported avoiding going to shops always or frequently, versus 51% in lower stringency countries. We track this to understand how people's collective behavior is changing over time in relation to policy, with the hopes that researchers can understand better how these behaviors affect transmission rates. However, I bring this up here because these types of behaviors have clear implications for brick and mortar shopping. And by tracking policy changes along with behavioral data and local footfall data, you should have a better idea of when people will return to the high street to shop. Now, we will have our first deep dive on mask wearing behavior available in a week or two. And we would encourage you to all come back to the ICL YouGov coviddata.com or to the GitHub page to download this data for 29 countries for free. At present, for example, we are looking at the differences between higher and lower stringency countries on wearing a mask in public. Higher stringency countries report wearing masks in public frequently or always at 73% versus 49% for lower stringency countries. This may have implications for virus transmission rates. An important consideration in life during and after COVID is life satisfaction. We will have much more to say about this in the coming weeks, but we will be announcing soon that the global leaders in this research are joining the Imperial College YouGov collaboration, the team behind the World Happiness Report, including John Hallowell, Jeff Sachs, Richard Layard, and Jan Emmanuel Deneuve. The World Happiness Report is a report published annually by the UN Sustainable Development Solutions Network. Life satisfaction provides a very powerful umbrella measure of the quality of people's lives. In the annual World Happiness Reports, differences among countries and over time in these evaluations are explained by good health, income, and 4 measures of the quality of the social context: trust, generosity, having someone to count on, and freedom to make key life decisions. All of these elements are changing under COVID-19, often in ways never experienced before. The YouGov life satisfaction data, collected regularly as the pandemic evolves in each survey country, provides a valuable barometer of life under COVID-19, reflecting each country's institutions and policies. Along with life satisfaction, good health, income, and quality of the social context, we are at the start of a long research dive on depression and anxiety around the world. Early figures indicate that there may be large differences in the global populations, with worryingly low levels of what we might call normal or no symptoms, as measured by the PHQ-4 in some countries in Asia that you can see toward the bottom, versus, for example, levels reported in the UK. However, and we will have more from this on our research collaborators in the coming months, the reported levels of anxiety and depression in Italy and Spain appear to be much, much higher, with Italy and Spain at 35 and 30% respectively, versus, for example, Germany with 16% reporting severe and moderate anxiety. Now, why track behavioral data, not just attitudes? For those of you who are familiar with the now ubiquitous R number, this will make sense, but let me briefly explain the R number. First of all, R is an estimate, and that is important to recognize and appreciate. One easy way to think of the R number, or the reproduction rate, is the number of people a single person can expect to transmit the virus to. This is a regional number. If a region has an overall R rate of less than 1, then a virus is reproducing at a rate which will not grow exponentially in a population. However, if the R rate rises above 1, then each person in the region is on average transmitting the virus to more than one person, and this clearly is a rate that grows exponentially in a population. The R number has to be estimated retrospectively because of the time lag between infection, symptoms, and deaths. And at the bottom, you will see the ways in which the R number has the opportunity to increase. It is these behaviors that we're tracking with the ICL YouGov dataset. Now let's focus in on the lower right of that chart. This is crucial. Who is a case? Without widespread testing, we cannot know who is a case or not. Most cases are probably asymptomatic, i.e. without symptoms. It's essential that each country take responsibility to isolate each case and look after them and their household members until all members of the household are healthy and clear of the virus. Their contacts need to be traced and notified, and it is at this stage, setting up this type of system of contact tracing, that many countries are in at the moment. Now let's move to exit strategy on the health side for a moment. There are 4 exit strategy principles from a recent World Health Organization communication: infection status, community acceptance, public health capacity, and health system spare capacity. Infection status and how it informs lockdowns and exit strategy. There are 4 things to watch here in order to predict what will happen next. And Will, if you can advance the slide. The rate of infection, which is expressed as a doubling rate, expressed as an incident rate, pardon me, and the doubling rate of infection, referring to the number of days needed to double the number of infected people, the case contacts, and testing rate of positive less than 5% of the population. Community engagement is the next principle, and this is very important. Without proper communication and engagement with citizens, local decision makers, willingness of the public and corporations and public services to comply is very unlikely. This is where attitudes and behavioral research is essential. Now, the very unfortunate message that is also in this communication from the WHO is that there may be consequences for companies and individuals as a result of the lack of coordinated preparedness that almost all countries have faced as a result of COVID. And that includes economically the population accepting new or increases in taxation, and certain employees, public and private, may need to accept reasonable reductions in income and reduced benefits. Now, are people complying with health directives, and will they continue to do so if restrictions continue? There are many ways of attempting to answer that question, and one place to start is by looking at some of the evidence about what is already known to drive people's health behaviors. The health belief model of health behavior pictured here suggests that key drivers of a positive health behavior, such as stay home, include a person's perception about the severity of COVID-19 illness, a person's perception of their susceptibility to the illness, what they perceive as the barriers and the benefits of staying home. Factors also include a person's general health motivations and the cues from their body or environment that they receive about the illness, such as symptoms, a dry cough, public health campaigns, such as stay home, save lives, and other cues, such as ambulance sirens. But there is growing sentiment among those looking at the data that trust in health advice and trust in government are also key to making actions stick, such as stay at home. Now, paramount to all of your businesses is the health and welfare of your employees, as well as your customers. And you are in the historically unique and very unenviable position of being in need of forecasting while taking into account uncertainties that have not previously been relevant to the realm of hands, to the realm of brands. And some of these constraints are truly out of your hands. Stores are shut, people are home. I would like to spend just a few minutes looking at models of how government and even brands can plan their actions around consumer behavior and attitudes change. Here we are looking at the ethical ways to nudge consumer behavior. This is called the Behavior Change Wheel by renowned world leader in behavioral change related to health, Susan Michie. On the outside in purple, you have the policy measures that surround people in their countries. Fiscal measures, such as stimulus packages, communication, such as public health campaigns. And on the next slide, you'll see it's very unusual for countries to use all of these policies in lockstep. The purple ring is the context in which we are all operating at the moment. And at the heart of these circles is the individual. That's the green. We'll get to how you go from purple to green in a moment, but let's look at green, the individual. Where does consumer behavior originate? Every individual's behavior starts with their perceptions of three things: their capability, their opportunity, and their motivation. An individual's capability is both psychological, their perception of what they're capable of, and their physical capability. For example, are people physically able to get into a store to shop, or are they confined to their homes? If shops are open, do they perceive they can get in safely? Individuals' sense of opportunity is also driven by their sense of what they can manage physically, and depends also to a great extent on what they perceive as socially acceptable. Their motivation is also driven by unconscious thoughts, automatic reflexes, and thinking. For example, are people withdrawing from those around them who sneeze or cough without even thinking about it? And in a happier setting and time, this could be walking by a Cinnabon counter in a mall and your stomach rumbling without your permission. Motivation is also governed by active thinking, such as it's hot out today and I don't have any shorts to wear. I think I'll pop out to get a pair. And I want to use public transport, but I don't have gloves or a mask so perhaps I'll stay home. If we advance forward one more slide, what we'll see is the orange and pink rings, and these are what both public health bodies and brands need to think about. To shape the green parts, the individual, the orange and pink rings are your toolbox, and you can combine them in any way except coercion, which is not ethical. For example, you can use persuasion to promote optimism, to influence capability, motivation, opportunity. And I'll skip over what the public health bodies are doing and give you my thoughts on how brands need to plan for economic recovery in terms of customer behavior. For example, some brands may use incentivization in pink, such as discounting or launching new ranges, to increase intentions in orange. The idea, of course, is to influence the green, the individual's capability, their motivation, their opportunity. Many retailers will be using restructuring the environment in stores, that's in the pink ring, to do the orange, which is shape beliefs about consequences of shopping in person. This ultimately has influence on the green, the individuals, and their sense of capability, motivation, and opportunity. I would encourage all brands to lean on this model or models such as these to keep the government policy in mind when planning your activities. And again, if you have questions about this model, please don't hesitate to get in touch by emailing info@yougov.com. Will, I'll hand it back to you. Thank you.
Fantastic. Thank you so much, Sarah. Fascinating stuff there. Looking at those models, getting behind R, which there's been so much talk about in the media over recent weeks. Right, that is the end of our content. It's now the opportunity for you to ask your questions. So please do enter them in the chat. I've also got some questions that have come in ahead of this webinar. I'll give you a minute or so to enter those questions there. But in the meantime, if you do have any further questions immediately after this webinar, or want to understand how you can gain access to any of YouGov's data that has been discussed today, please do email us at info@yougov.com. As I said at the start, we will also be circulating a copy of these charts and a recording of the webinar to those that attended. So please don't feel as though you have to reach out to us for those slides. They will be coming within the next couple of working days. Right, I'm going to open up the chat and see what we've got in there. Not a huge amount at the moment, so I'm going to move to the questions that came in ahead of time. So there's quite an interesting one here. I think this is probably to Sarah or Gavin. There are massive differences across Europe in terms of people's willingness to isolate and people's mask wearing and hand washing. Is there anything from your point of view that can explain why there are such vast differences?
I'm happy to take that one. Some of the differences can be explained, of course, by local policy. There are government restrictions that have been so-called locking down people into their homes, but with more gentle guidance on things like mask wearing in public. We believe that it's very important for government and public health messages to be crystal clear about what behaviors they are expecting from citizens. Guidance that is not mandatory can be very confusing for people who are already struggling with a lot of information and change in their lives. This may account for some of the variation. Another source of variation, as we touched on in the webinar, may be trust in the government and trust in the health messages that are coming from the government. This will probably become more and more important over the coming weeks as restrictions ease and countries emerge out of lockdown.
Fantastic. Thank you very much, Sarah. Gavin, anything to add to that?
No, I don't think so. I think that summarizes it. It's clearly, though, what I draw reference to is the change over time on many of those behaviors. It's very, very striking. there was an example that we looked at recently, which showed another country in the Far East going from a figure just above half of those people wearing face masks up to 95% in just 3 weeks, which is an incredible sort of rate of change over time. So I wonder that if we can give this, a few more weeks, or come back to this in say a month or 6 weeks time, we may well find there's actually a lot more convergence between behaviours across Europe as people sort of settle into a new kind of normal way of behaving in terms of how they take some of the preventative measures that we know they're being advised to.
Got it. Fantastic. Thank you. There's a really interesting question coming that's just come in about the Stringency Index. I think, Sarah, it's probably possibly one for you. The question is, how did you define countries of high stringency versus lower stringency? And can you give some examples of countries at either end of the spectrum?
Yes. So Oxford University produces a stringency index, which is available on their website, which was used to create that map that you saw earlier. The stringency index refers to all the restrictions that they're tracking. It doesn't just refer to, for example, lockdown. It includes fiscal measures as well. So I use the median, which is 85 on the index, to delineate the higher and lower. I wouldn't call them high versus low, but higher versus lower, because we chose the median to split them. The Netherlands, France, Spain, India, Mexico, Italy, Vietnam, those are at or above the median. Denmark, Sweden, Finland, Norway, the UK, Australia, Canada, Germany, Taiwan, Malaysia, Indonesia, Philippines, Thailand are all below median stringency. But I encourage you to visit the Oxford University COVID Policy Index to download that data and track it. It's extremely useful, and it's available in many formats, including maps, not just numerically.
Fantastic. And Sarah, just to dig into that a little bit more, it's not a fixed index, is it? It's dynamic over time as measures such as everything from fiscal stimulus to restrictions on physical movement change. Is that correct? That
data is updated every day for every country in the world. It is absolutely dynamic.
Fantastic. Thank you very much. Please do keep your questions coming in. If there are any more, do use that chat function. I think there's one more. It's a very big question that we got ahead of time. It is, what are the data saying in the round about the way the world population is or is not able to cope with a second peak? I don't know whether, it's a very, very big question, that one. Gavin, any thoughts on that?
I suppose the data is showing, as I just previously mentioned, quite a bit of change over time in the way that people are behaving. And I think that that's why doing something like we've done here, which began all the way back in late March and is tracking people on a regular basis, is so important, because it really shows it shows the kind of ups and downs of behaviour. And I think probably we need to probably bear in mind that some of the things that have happened, some of the behaviour change that has occurred could go back down again. So there could be, well, sort of peaks and troughs in the way that people are, in people's attitudes and behaviours. But I think that the key thing in thinking about a second wave, therefore, is to carry on seeing how behaviour is changing. And if it is the case that more and more people are adopting some of those preventative measures, such as the mask wearing, such as the remaining to work from home, even though they could perhaps physically go back into the office. I'm thinking more in the professional services area. If people carry on doing that, for a longer period of time, then there is going to be a greater level of preparedness for a second wave should that strike.
Fantastic, thank you, Gavin. Sarah, anything to build on that?
I think that the most important data to track in terms of a preparedness for a second wave is, I think, the economic data, frankly. I think that most of the behaviors that we are tracking have shown that people are willing, more or less, to participate in a coordinated global effort to stop this virus. I think that willingness will certainly decrease, and I'm not saying this from a scientific point of view. I'm saying this from a perspective that I think we can all sense, that a growing fatigue of restriction will be related to people's ability to earn a living, and a second peak could potentially be something that comes with people's increased interest in participating in the workforce outside of their homes, for example. So I think that is probably the greatest danger that we have. There certainly is a pattern of governments, some certain large governments, moving before the scientific evidence is there, saying that it's safe. But I think we will have a lot more to know about that in the coming 8 weeks or so.
Excellent, thank you very much. One quick question that I think I can deal with, and then I'm going to come to Gavin to talk about a question that we've got on Germany's lower willingness to isolate. But the first question that let me deal with is, we've heard a lot today about behavioural data. What other data does YouGov have in relation to consumer behaviour and consumption? The answer is a great deal. If you remember at the beginning of this presentation, I talked about or showed a chart with the 3 pillars of YouGov's data. The pillar to the far right-hand side of the screen, our consumer monitor, does exactly that. So that is monitoring levels of consumer change in consumption, in spending. It's looking at economic confidence, it's looking at employment, it's looking at future consumer habits as well, such as future use of cash, willingness to go on holiday overseas. It's looking at taking part in the local community and volunteering, as we've seen a groundswell of people sign up to support their local community and those more vulnerable than them. So the short answer is yes, we do have a great deal amount of information on that. Please do contact us at info@yougov.com, and we'd be delighted to discuss that with you. Gavin, I think we've got time for one more, so I'm coming to you. Early on in the presentation, you showed us a chart about Germans being less willing to isolate. Just wondered if you've got any commentary about that, and any thoughts.
Yes, I found that quite striking. That there was that difference there in Germany compared to many of the other countries in terms of their willingness to isolate, and I did wonder whether that was connected. I mean, there are different policies in different countries, different sort of nuances. I wondered if that was related to some policy differences there, but I also wondered if that is changing over time. That also could be related to increased confidence in the way that the country is handling the virus in terms of testing, or in terms of other kind of preventative measures that then no longer seems to feel like it's so necessary to do that as it was before. But I don't know if Sarah's got any thoughts on that quite striking difference with Germany.
Well, it's certainly possible. I think that early on in the pandemic, Germany was very quick to make very bold measures to contain the virus. That, I think, has probably, and I'll avoid making assumptions about causation here, but it's likely that that contributed to a better confidence in the country's ability to take action to manage. As to whether or not the high level of testing is directly related to willingness to isolate, it's something that I think the social scientists in Germany should be looking at directly. There are things outside of our survey that we would need to look at in order to really have confidence about that. For example, a longitudinal panel. But it's certainly possible. I will say that.
Fantastic. Thank you all very much. I think that's the end of our questions that have come in on the chat. So thank you all very much for those. We'll wrap up here. So thank you, huge thank you to Gavin Ellison and to Sarah P. Jones from Imperial College London. Some great content. Please do look out for the next YouGov COVID-19 webinars. We're going to go back towards more of our usual content, looking at stories around the pandemic, looking at audiences, looking at the impact that different brand behavior has had on brand perception in our connected data series. We're then going to come back towards the end of June with an update on our consumer monitor and economic confidence indicators, so please do look out for them. So it's a goodbye from all of us. I hope you have a wonderful day and stay safe. Many thanks. Goodbye.